troubling news about women and heart disease.
A brand new survey out shows there's an epidemic of misdiagnosis. 84% of cardiologists say they have female patients right now whose heart issues were misdiagnosed by other doctors. Well, since this is Heart Health Month, we're shining a light on women and heart disease. 63-year-old Maria Cattani looks and feels fantastic today, but that wasn't always the case. She wasn't even 40 years old when Maria began to feel weak and noticed her lips were turning purple.
It was hard for me to walk or go to the stairs, and I couldn't run because I went out of breath.
At first, doctors told her there was nothing to worry about. Then she met with Dr. Sandra Chaparro with the Miami Cardiac and Vascular Institute and was diagnosed with heart failure.
Maria presents with the typical symptoms of heart failure. So usually in female patients is very inspecific: fatigue, shortness of breath, weakness. So sometimes that progresses to palpitations if you have irregular rhythms.
Because women often have less specific symptoms than men, heart issues can go undiagnosed. But more than 60 million women in the U.S. do have heart disease, which is the leading cause of death for women.
Around 6.8 million people in the United States have heart failure, and the prediction is that it's going to increase because of the population is getting older.
Maria eventually underwent a heart transplant and now takes part in the Women's Heart Program at Baptist Hospital. And today, she has this message for you.
Take care of yourself. That's the most important thing. Take care of yourself and, follow up with any treatment that you have to do to have a better life, because life is beautiful.
Very true. Now, a couple more notes here. Cardiologists say they're treating more younger women today than they were 5 years ago. Obesity, high blood pressure, and stress are rising risk factors there. So, by the way, is having COVID early in the pandemic. And a reminder, tomorrow is Wear Red for Women Day, so you're going to see a lot of us wearing red tomorrow as a reminder that we all need to take good care of our tickers.
It's so important to actually place the attention on that, because
Yes.
we cannot have enough information, and it's constantly changing and upgrading
It
every
is.
single year.
And women's symptoms are so much different than men, and
Right.
so it's just something that you need to talk to your doctor about and just know your body.